Howdy folks, I'm here with Jennille Zabierek, who's a physical therapy specialist extraordinaire, and she has earned her degrees in physical therapy as well as her doctorate in physical therapy from Concordia University. That she has her DPT, OCS, as well as a number of other postnomial. So many I can't even remember them off the top of my head. But she is a specialist in orthopedics, particularly sports medicine as well. So it's excellent to have you here because we certainly have a lot of patients who have pain, regardless of whether it's from a sports injury or not. She can certainly take care of that. My name is Singa. I'm a pain physician, specifically interventionalist at Repulse Spine Pain here in Austin, Texas. And we wanted to go through a few questions because you are the expert in physical therapy, and oftentimes patients come to us and they don't want to go to physical therapy, or they don't perhaps use it to the best of their ability. And so we want to perform a service to the public and community in order to educate them about how important it is. So first off, what are the top misconceptions about physical therapy?
This is probably the most important question, and it's a lot of things that I talk to patients about too, because they come in and ask me questions for sure every day from day one on. The top misconception that we get in PT is that physical therapy has to hurt in order to be effective. And really that can be farther from the truth. A lot of people will say, patients will come in and say, well, it's no pain, no gain, right? And really our phrasing and our mantra here is no pain, more gain. If we can move efficiently and effectively through pain-free movements and restore those movements, then all the movements will do better and people will get better faster. So that's the first misconception, is physical therapy should not hurt at all in order to be effective. Another common misconception is that physical therapy is the same as going to a gym. I can just go to a gym and do this. And while both things, PT and going to the gym, does combine exercise, the difference is that PT is really focused and tailored specifically for the functional deficits that each patient comes in with. So we understand exactly which exercises to prescribe at which dose that's going to get them back to their functional goals.
And would you, sorry to interrupt, but
No, you're good.
A tangent off that, we have some patients who are really strong and they go to the gym 3-5 times a week. They're the ones who say, well, I go to the gym, why do I have to do physical therapy? Would you say that they should continue those exercises they're doing, or just for you to evaluate them and say, well, those exercises are appropriate, please also do these?
Yes, so I think that's a fair question. And if somebody is already motivated and going to the gym, we definitely want to capitalize on that. So when they come in, the physical therapist will for sure review their current gym program. It could be that those exercises are absolutely fine to do, but there might be ones that they can supplement as well at the gym using some different machines. There may be also times where some of the exercises might actually not be the best to do right now. So that would be reviewed by the PT. Also, there may be just some things that maybe they're just not strengthening the right muscle groups at the gym. And so there's things that we will be able to provide them to help that out. But going to the gym is a good thing. We just want to make sure that it's utilized effectively and that they're not doing anything to cause any setbacks in PT.
Okay, that's right, excellent. And any other misconceptions?
Yeah, I think the last misconception that is really common is that all physical therapy is the same and that it's a waste of time. And really it's not. There used to be a time back in the day, I've been around a while, I mean when I went to school and that sort of stuff, we got taught a lot about, oh, you put the hot pack on and then you use the ultrasound and then you get a massage, and those are all really passive treatments. And really the evidence in the research-based treatments are showing that it's really an active process with PT. Now, there may be a component of manual therapy. That's a really important part of physical therapy, but it's just one part. It's the supplementing of the exercises, which are a wide continuum of exercises too, that it could be. So it's not a waste of time. We're working to get you better, and it's not your old school PT of what we call the Hummer method, the heat ultrasound massage. It's completely different. It's all evidence-based now to get better faster.